government's decision to push full steam ahead with the National Health Insurance Scheme has some people up in arms, whilst others have cautiously welcomed it as a necessary step towards developing a pro-poor and more equitable health system for the majority of South Africans. Joining me to debate the issue this morning is the woman heading up the Presidential War Room on the NHI, Dr. Olive Shisana. She's coming to us from our Cape Town studios. And here with me in the Johannesburg studios is Mia Malan, the head of Bekisisa, the health journalism unit that's covered the plan in news stories in many print and media outlets. Good morning, ladies. Thank you very much. Professor Shisana, or Dr. Shisana, let me start with you. The very latest that we have on this matter is that the Democratic Alliance has said that they're going to take the matter to the Constitutional Court, and Dr. Zweli Mkhize, the Health Minister, has responded by saying they're happy for the bill to go to court. He's got nothing to worry about. Do you share Dr. Zweli Mkhize's optimism that you will win in the courts should this bill be challenged in its current form?
I'm fairly certain that we definitely will win. And the reason for that is that the initial bill was drafted by a constitutional lawyer, a professor, because we expected these problems, that people are going to try to use the Constitution to deny the right to health care for all in the country. We knew this was coming, and the minister is correct when he says that he's comfortable with the DA taking it to court because we've got nothing to fear.
Just let me stay with you on this matter. One of the reasons why he says he's so confident is he says that the National Health Act was also one that was discussed with provinces because there's, of course, concurrency. And what I mean by that is that there are powers that the provincial health authorities have that is concurrent with the powers of the National Health Ministry. So do you think that that alone gives you the kind of edge over any attempt to try and derail this process through the courts?
Yeah, let me start by saying that in 1994, Minister Zweli at the time was MEC of Health, and I was Director General of Health. First of all, I was special advisor to the minister and then became Director General of Health. When we're doing this, we sat down with all of the provinces at the time and we said, let us interpret what the Constitution says with regard to the powers of the provinces vis-a-vis the powers of the national. We sat down and we took all what we inherited from the apartheid past and made the divisions of responsibilities to ensure that there's concurrency and there is coherence in terms of running the health system. So when the NHI bill was actually prepared, in fact, starting with the white paper, there was a lot of discussions and, unpacking of this entire concept of national health insurance and how it's supposed to work between the national and the provincial. I served for 5 years as a chair of the Ministerial Advisory Committee on National Health Insurance. And that document that we prepared was discussed extensively between the national and provincial. When Minister Mkhize came into office, before Minister Mkhize, when Minister Mtswaledi came into office, he also discussed the white paper, the policy and everything with the provinces and the national. Thereafter, when Minister Mkhize came, he had that meeting with the provinces to actually engage with that. So what we are comfortable with is that we have followed up the intergovernmental processes required in terms of development of policy. The Act, the National Health Act states, before you table a bill to Parliament, you must actually take that bill and engage with the provinces. He has done that. He has met that constitutional requirement.
All right, let me shift the conversation to you, Mia Malan from Bekisisa. Now, we know, of course, that provinces are actually quite powerful. They get the largest chunk of the budgets in most sectors, health included. And the provinces are pretty incapacitated, both in terms of staff and so on. And one of the NGOs that raised the question of staff vis-a-vis all the people that need to be served under the National Insurance scheme is the TAC. They said the current amount of health workers, from doctors to nursing assistants, simply doesn't measure up to what is required to fund or rather serve all the population in the country. Do you agree with that criticism and that worry?
Well, I certainly think it's a valid concern, not just from civil society. Government has also expressed concern about the number of health workers that we would need to sufficiently staff a national health insurance.
So if one looks at the question around capacity, because I think both yourself and Dr. Shisana is on the same page as regards to more equitable healthcare for the poorest of the poor, and that the current system is unsustainable. Let's look at the capacity of the state. Say hypothetically this bill gets enacted tomorrow. Will a place like KZN, who up to a few months ago didn't have any cancer machines, will they be able to, if any hospital meets the requirements there, be able to actually carry out?
I do think that in order to help the process of implementation, we do need to look at certain concerns. And I think in terms of capacity, there are two aspects we need to look at. The one is what you've mentioned, do we have enough health workers and where will we get them from? But the other one is the administration of the actual scheme. And it suggests the creation of a massive bureaucracy. If you look at the moment, the state sector serves 16% of the population. We would need to register the entire almost 60 million people in South Africa for this scheme. And the bill makes it clear that it's not going to use private capacity to help to do so. So it's not going to use medical administrators to, for instance, help to process payments. And those administrative tasks are massive, and they do create a lot of leeway for corruption to seep in.
Okay, let me put this question to Dr. Shisana. You've heard Mia Malan's question. She's raised two issues here. She's raised the question of the administration of this massive fund and the potential for corruption. And she's also raised the question that I raised, which is just your ratio of professionals serving the population. You can't even compare the two figures. Let's start with your person power. Obviously, this is going to be a phased-in process, but do you have the people to actually make this work, especially if some doctors are already indicating that they'd rather go and work elsewhere?
Okay. You'll recall, Karima, that there was a presidential health summit that was held last year in October. And at that summit, there was a massive discussion on the challenges that are facing the healthcare system, as well as recommendations for what needs to be done to improve the healthcare system. In that meeting, we had a cross-section of the stakeholders in the health sector, including the medical profession, people coming from the medical profession, from the nursing profession, and so forth. And we all identified the challenge of human resources. And we said, these are the strategies that we need to take in order for us to be able to provide healthcare in the country. We are now in the process of beginning to implement those interventions. So it is not something that we are not going to be able to address. We know it's a problem. We've got strategies. We've identified them, which include, obviously, ensuring that we train more, ensuring that the nursing colleges are operating with the new curriculum, which has happened just now. They'll be starting in January. They'll be training more nurses. We'll be bringing more nurses from Cuba, more doctors from Cuba, and making sure that they are integrated into the system. In fact, we are bringing about 700 and 800, of these doctors that are coming. So the plan is to bring all. I didn't hear the doctors who were part of the summit saying that we are going to leave the country. If anything, they were saying, we want to improve this healthcare system so we can be able to practice in it.
Okay,
they
Dr.
agree
Shisana,
they want to have a universal health coverage system in the country.
Dr. Shisana, let me just interrupt you with respect. You talk about the fact that you are going to source people from a whole range of places, and many people have already come forward. You're going to churn them out through the colleges. I just read a report this morning that says the US is running out of nursing staff, and the nursing staff is aging. Now, I mean, the US is described as one of the most developed countries in the world. We know that they have a terrible health system, and particularly a very bad public health system. If they can't cope, and we've had the problems that we've had at ESCOM, at the SABC, at Denal, of skilled public servants, or even at municipalities with municipal managers, auditors, and so on. Where do you get the confidence from to tell South Africans, without fear of contradiction, that you will be able to meet this requirement?
Remember that the NHI is not implemented overnight. There is no big bang approach we're talking about. What we're talking about is progressive implementation up to 2026. By 2026, we'll have been able to implement. So we've got a plan which we have to roll out systematically, roll it out until such time that we have enough to provide services. We'll never have 100% enough healthcare workers. And one approach that we are going to be using is what they call mHealth and telemedicine, where you can use community health workers at home to try to prevent those conditions that to develop. For example, if somebody has got diabetes or has hypertension, if you send a community health worker to learn to teach people how to test themselves, to monitor it, they should only come to the health facilities when the need arises. When the need doesn't arise, they don't come. Okay, so you decongest the system, and that reduces
Dr.
the number of health workers.
I hear what you're saying. I hear what you're saying, but I want Mia Malan to explain to us. The idea is perfect. We have other health initiatives around, let's say, the way in which people who are complaining about sexual abuse and gender-based violence must be treated, right? And I had you on this very program to talk about the fact that it becomes a political football that one department kicks around from another department. Dr. Shisana is suggesting that you're going to have a perfect cooperative system where all the departments are going to be playing their part. Give us your practical experience at the moment of whether this is happening, let's say with the case of the kind of support that we're supposed to get for gender-based violence, which is of course putting a lot of pressure on our health and social services.
So with regards to gender-based violence, the Tutuzela care centres that we have at the moment are really underfunded because of a various range of reasons.
Yeah.
But maybe we can make it even more concrete and say, let's look at how will we get the health workers.
Yeah.
Now, Dr. Shisana has mentioned that there is a plan in place, and it's true that the social compact that was signed mentions various strategies. One of it is to look at the role of the private sector to give us more nurses. We've got a shortage of 50,000 nurses. The social compact, for instance, says. But then we also, and we have a new university, a medicine faculty, the University of Limpopo, but let's say most of the doctors, or that a big chunk of the doctors would need to come from outside of the country. One of the biggest problems of people who wanted to come into our country to come and work as health workers is registration.
Yes.
And the Health Professions Council is not just really inefficient with registering these people, but there's also corruption. It is being investigated by the SIU at the moment, and so is our National Laboratory Service. So it is not invalid concerns that we only have 7 years to get to the point where we have a national health insurance that's fully functional, and that a range of things would need to happen during this time. Now, some experts argue that it's wishful thinking to think that it would happen by then, but I do think there is a lot of pressure on the government, especially from COSATU and trade unions, to get this implemented in time. Having said that, when we decided to implement termination of pregnancy, that act, abortion services, we certainly did not have everything in place. We started to implement. You can't wait until everything is perfect, but you do need a fair amount of things.
You need a base from which to start. Dr. Shisana, given what Mia's just explained, right, we have a 50,000 deficit when it comes to nurses, and of course we know that everything is not going to be perfect and will get better as we start it. But do we have a base requirement, in your view, to actually make this happen, given the levels of corruption that Mia has been speaking about, and also the fact that the SIU is only busy now with those investigations?
Okay. Basically, we have what we need to start. I think the problem is that people think of NHI as this big boulder that's coming, you know, to crush the system. The system that is there, it's a solid system. It may have problems, but it's a solid system. We've got clinics, we've got hospitals, we've got staff. We're providing comprehensive services currently. We are providing medicines. We are providing equipment. There is the private sector also in terms of the general practitioners around the country. There are hospitals that are functioning. We spend 8.5% of the GDP on healthcare. So we're not bringing a boulder into a vacuum. We're bringing this boulder of NHI into a resource system, but not adequate for what it is we need in order to implement NHI. So we've got gaps. So we need to identify those gaps.
What are those
now,
gaps?
I hear this thing about corruption, where the gaps are identified, as I indicated earlier to you, that we had a presidential health summit. We indicated human resources. We indicated at times access to medicines. We indicated access to infrastructure. We indicated in the document that we dealt with the need to improve the relationship between the public and private sector so we can all cooperate and work together in order to deliver services that we need. We've got gaps with regard to the question of corruption, which I'm going to come to right now. Give you some details in terms of how we're dealing with.
We're running out of time, Dr. Shisana.
And also, we've got the...
We're running out of time. Just quickly move us to the issue of corruption.
Okay.
How are you going to deal with it?
Okay. With regard to corruption, we are very clear in terms of the strategy we're going to use. We have indicated we need to set up a unit within the department that is supposed to be addressing corruption together with the Special Investigative Unit, the Financial Services Finance Intelligence Center, the NPA, the Department of Health, the Council of Medical Schemes, the Health Professions Council. That forum has already started, and we want to use that forum to detect corruption, prevent it, and prosecute those people immediately through special tribunals. So there is a clear plan in terms of how we're going to try to prevent corruption in the system.
Mia, you've dealt with corruption at a small and medium level and also at a very high level. What Dr. Shisana is putting in place, can it work?
Well, what Dr. Shisana is mentioning is one of the concrete suggestions in the social compact. It really is there, and there's a timeline for it. Can it work? Well, I would love to see more details. I have not seen the details of how that will be implemented. If we just look at something like Life Esidimeni, we still have the former health MEC, Kudani Mkhlango, who's being investigated, that we haven't seen anything happen.
You haven't even seen a charge sheet.
There's Brian Klonga, you know, who's also being investigated, and we haven't seen.
So the turnaround time is just not enough. Ladies, thank you so very much for joining us. There's much to discuss, and I'm going to have you both back here because we want to actually get into the granular detail, because I think there's also a lot of confusion and a lot of, scaremongering that's going on about this system. So I'll have you back. Thank you very much, Dr. Shisana, the head of the War Room, Mia from the Bekisisa Health Centre. Up next, we look at the top stories in the weekend newspapers. Stay with us. Don't go anywhere.